Hi, I'm Dr. Paul Silberman,
Hi, I'm Kayla.
and we are here today, Kayla and I, my assistant of 3 years, to talk to you a little bit about pregnancy and the effect on your teeth.
A lot of my female patients that I see obviously can tell that I'm pregnant, and they tell me that when they were pregnant, they were always scared to go to the dentist. They were told dental procedures could harm their fetus, which is not necessarily true at all.
It's not true. Concerns about harm coming to the baby through dentistry, it's just not the case. I mean, there's nothing in the anesthetics or any of the treatment that we render that would cause a problem to the developing child. So it's very important that you come in for a regular examination. With hormonal changes that take place, we see gum swelling, gingival swelling, some bleeding, that sort of thing that you wouldn't normally have. These pregnancy gingivitis situations, as they're known, it goes away after pregnancy, but during that hormonal change that your body is going through, it's very important that you stay on top of having your teeth cleaned. If you postpone treatment, there are problems that can develop, and it's more harmful to both you and the baby if you postpone treatment.
The acid from the acid reflux and the vomiting tears up the enamel of your teeth, which is why you want to stay on top of your regular dental visits.
After the episode, you should rinse, and you should rinse with a combination of a teaspoon of baking soda in a cup of water, and rinse with that. That will neutralize the acidic effect of the stomach acids. And wait about an hour before you brush your teeth, just in case, because you want everything neutralized, and you don't want to be brushing your teeth right afterwards, because then that acidity gets scratched into the tooth enamel. But we would like you to come in on a regular basis. If you're having those issues, that's the situation where you would come in every 3 months, because we want to make sure, we want to stay ahead of the curve. If there is any acid damage to your tooth enamel, we want to be able to address it with remineralizing with fluoride and that sort of thing, so we can get ahead of the curve on that. There are some circumstances where you're having a dental crisis, a dental pain. You go to the dentist and it's diagnosed that you need a root canal or you need an extraction. Those things are still doable while you're pregnant. It's not our first choice, obviously, because we want you to be comfortable and healthy, but if these things happen, then it's okay to get treated. It's more important to get treated than not, because the bacteria and that sort of thing can get into your system and affect the baby. You don't want that to happen. If you're having pain, go to the dentist, get it evaluated, get it treated. Don't self-medicate. You don't want to overdose on Tylenol and that sort of thing. That also is not good for you or the baby. So see your dentist, get it taken care of, get out of pain. Sometimes where the gum comes to a point between your teeth, you can get what looks like a little raspberry growth. It's called a pyogenic granuloma. Not to worry, those things will disappear after pregnancy most times.